Hello, my name is Mia Cifuentes. Today we'll be talking about Tooth Wisdom, which is a program that focuses on promoting good oral health, why oral health is important, oral health conditions older adults commonly face, oral care techniques, visiting dental professionals. Let's get started. Contrary to what you might think, losing your teeth is not a natural part of aging. Many of you are keeping your teeth longer, so we want to equip you with some oral healthy tips and tools to continue to keep your teeth for a lifetime. The health of your teeth and mouth affect the rest of your body. The mouth is the gateway to your body, so issues with your oral health may lead to problems in your overall health. For example, poor oral health can increase blood sugar levels in diabetics, seriousness of heart disease, risk of stroke, risk of aspiration pneumonia, risk of infections in other parts of the body. To reduce your risk for developing these conditions, you'll need to know the best tools to use and how to use them so you can follow a good oral health routine. What are some products or tools you use for your oral health routine? Today we're going to talk about toothbrushing techniques, flossing techniques, denture care, mouthwashes. Before I demonstrate how to brush and floss your teeth, let's talk a little about tools of the trade. You don't need to brush your teeth so vigorously. That can give you sensitive teeth, gum problems, and make cavities more likely. And yes, those soft brushes really do a good job removing food and bacteria. No need to use a bristled toothbrush. You can strengthen your teeth with a toothpaste with fluoride. Any toothpaste with fluoride will work, but only use a pearl-sized amount of toothpaste, not a large swirl like they show on the TV commercials. Avoid using bleach, baking soda, or salt. They can damage your enamel and make your teeth more sensitive. If you like to use salt, you can make a solution and rinse your mouth. It's important to keep your brush clean and dry in between uses. The American Dental Association recommends consumers replace their toothbrushes every 3 to 4 months or earlier if bristles are frayed like the ones in the picture. Also, you should replace your toothbrush after you are sick, and do not share your toothbrush with family or friends. I'm going to use this model to demonstrate the latest advice on how to brush your teeth. The amount of time you spend brushing your teeth each day is just as important as the number of times a day you brush your teeth. The number to remember is 2. Brush 2 times per day, once in the morning, once before bed, for 2 minutes long each time. It's important to brush twice a day, but in the case you can only brush once, the best time is before bed. Let's go through the steps of brushing your teeth. Step 1. Wet your brush. Use a tiny pearl-sized portion of fluoride toothpaste. Place the toothbrush at a 45-degree angle with the brush bristles towards the gum line. Step 2. Use short strokes to move the brush back and forth gently in short strokes before the outer surface is still angling the bristles towards the gum line. Step 3. The inside surfaces with the same angle towards the gum line. Step 4. To clean the inside surface of the front teeth, tilt the brush vertically and make several up and down strokes. Step 5. And brush the chewing surfaces of your teeth where food often gets trapped. Also, remember to brush your tongue. Brushing your tongue removes food and bacteria that causes the bad odor. It's important to brush your tongue to keep your breath fresh. Brushing your tongue can also improve your ability to taste and avoid the re-entering of bacteria into your body. Some medications can cause a coating to form on your tongue. There are also tongue scrapers and brushes sold at your local drugstore. Be sure to brush your tongue from the back to the front. Sometimes it's hard to use a toothbrush in a way that's comfortable. There are some things that you can do to make things easier. Wrap a washcloth around the brush hand and secure it with rubber bands. This will make it easier to get a good grip on the brush. Foam or tape also work well around the toothbrush handle. Stick the end of the brush into a tennis ball or bike handle grip to make a super handle. Another device that makes brushing a little easier and effective is a power brush or electric toothbrush. These types of brushes do a lot of movement for you. Still, be sure to angle the bristles towards your gums. Now let's talk about flossing. It's very important to clean in between your teeth. Flossing helps to remove food and bacteria between your teeth, which, if left behind, can create cavities. You can use any kind of floss that you like. They all do the job. The best time to floss is at bedtime. Cleaning between your teeth with dental floss is an important part of your oral routine. I'm going to use this red yarn to demonstrate how to floss your teeth. Step 1. Use about 18 inches of floss around one of your middle fingers with the rest around the opposite middle finger. Step 2. Pinch the floss tightly between the thumbs and forefingers to maneuver and guide the floss between the teeth. Step 3. Curve the floss into a C shape against the side of your tooth. Step 4. Gently glide the floss gently up and down. Keep it pressed against the tooth. Don't jerk or snap the floss. Floss all the teeth. Don't forget to floss behind your back teeth. Note that there may be some bleeding the first few times you floss, but this will improve with use. Be sure to let your dental professional know of the bleeding and wear. If it is difficult for you to use regular floss to clean between your teeth, there are other aids that can be used that may be easier. Aside from floss, these are some examples of items that can be used to clean in between your teeth. Soft picks, floss picks, water flosser, proxa brush, interdental brush, treat brush, floss holder. If you have only a few teeth or dentures, brush your teeth and gums every day and clean your dentures. Cleaning your dentures every day will keep them looking new and attractive. Let's talk about how to properly clean your gums and dentures. You want to keep your dentures in good shape. If you have teeth or partial dentures, remember to brush your teeth and tongue and clean your dentures every day. At bedtime, clean your gums with gauze or a washcloth. It's good to remove your dentures after every meal and rinse them and your mouth with water to remove food. Before you clean your dentures, line your sink with a washcloth or towel or fill it with water, so in case you accidentally drop them, they will land softly. Hold the denture with your full hand. It is best to use a denture brush for brushing your dentures because it has special curves. However, a regular soft bristled toothbrush can be used to clean your dentures in the case you do not have a denture brush. After you clean your dentures, rinse them well with water. Use denture cleaner or warm water when brushing dentures. Do not use toothpaste on your dentures. It is too rough and can cause scratches in the denture material, in which bacteria and food can get caught in and collect. Be sure to remove your dentures at night to allow for your gums and tissues to breathe and take a break. You can dissolve a mild denture cleaner or fizzy cleaner tablet in the water if you like, but do not soak your dentures in any other products. Store your clean dentures in lukewarm water overnight. Do not use hot water because it can change the shape of your dentures. Keeping your dentures moist keeps them in shape and more comfortable to wear. In the morning, rinse your dentures with water before you put them in your mouth. Also, remember to wash the cup in between the use with light soap and water. Many people like the security of denture adhesive, but if the denture fits correctly, one should not need it. As a person ages, however, the ridges in the bone may not hold the denture anymore, and adhesive may be desired. Be sure to remove all adhesive every day because it carries bacteria. If your dentures are loose-fitting or causing sores, the best treatment would be to take it to the dental professional to have it realigned. Remembering a few tips will help keep your dentures in great shape. Hot water is the enemy for dentures. It can change the fit. Please, no dishwashers for dentures. Be gentle with your dentures and keep them away from baking soda, bleach, mouthwash, and other cleaners. Don't try to fix a broken denture yourself. Visit your dental professional to get a professional repair. Remember your dentures and store your dentures in water overnight. You want to allow the gums to have a break. Use a denture brush to clean your dentures in a sink lined with a washcloth or towel. See your dental professional, as they will make sure that they have the best possible fit for your dentures. Now let's talk about mouthwashes. For your mouthwash to work well, you should start with a clean mouth. Brush and floss before you rinse. If you rinse before you brush, you just brush off the rinse from your teeth. Rinsing with mouthwash makes our mouths more comfortable, moist, and also promotes the fresh-smelling breath, but it is not suitable for brushing and flossing. Rinsing with mouthwash makes our mouths more comfortable, moist, and also promotes fresh-smelling breath, but it is not a substitute for brushing and flossing. It's great to rinse after eating out, when you're not likely to run off to brush your teeth. There are many mouth rinses to choose from at the drugstore. It's best to choose mouthwashes that don't contain alcohol. Alcohol in mouthwash can cause dry mouth, increasing the risk for cavities and can irritate sores. Mouthwashes containing fluoride are best to prevent cavities. There are some mouthwashes that can't be found at the drugstore and that need to be prescribed by a dental professional. Chlorhexidine and Pyridex or Paragard is a special kind of mouthwash that is prescribed for people with gum disease or for people with chronic illnesses such as diabetes. It can also help with bad breath. When using a mouthwash, whenever over the counter or prescribed, use the amount of mouthwash shown in the directions on the bottle. Pour the liquid into a cup and then into your mouth. Mouthwash does not replace brushing and flossing. You must still brush and floss. However, mouthwash can be added to your oral hygiene routine to help kill germs and freshen breath. Spit out completely. Try not to eat or drink for 30 minutes after you rinse. Don't forget water is also a great rinse for your mouth. If your water is fluoridated, you will remove bacteria and food while you strengthen your teeth. You can always ask your dental professional about mouthwash instructions or follow instructions on the mouthwash bottle. Dental professionals are key to good oral health. See your dental professional even if you don't have any teeth or don't sense any problems with your teeth, mouth, or dentures. Go for routine visits and cleanings. When visiting a dental office, there are some things we want you to talk to your dental professional about. Be sure to share any changes in your overall health history with your dental professional. Sometimes we don't think about telling our dental professional about our recent knee surgery or heart attack. But remember, we mentioned before that our oral health affects the rest of our body's health. Tell them if you have a heart disease, diabetes, high blood pressure, or have had a stroke. Ask your dental professional their recommendation on how often you should schedule dental visits. The most commonly recommendation is every 6 months, but some are suggested to visit more frequently, sometimes as frequent as 3 to 4 months. Provide a list of your medications with how often you take them and their dosages. These medications could be affecting your overall health condition and affect the type of treatment that is planned on your visit. We'd like to recap the reasons to visit your dental professional. For routine checkup. Again, you do not only go when you have a problem. It is important to visit regularly to ensure no issues are occurring or will occur in the future. If you have pain or discomfort, bleeding gums, sore or spot that hasn't gone away in 2 weeks, if you're having problems chewing, swallowing, and eating, if you notice to have dry mouth, check if your dentures are fitting properly. Many events may occur at your dental visit that you should be aware of. A visit to a dental professional may also include checks for oral cancer and other problems that are best treated early. Your dental visit usually includes examining your teeth, gums, tongue, and the inside of your mouth, x-rays to check for cavities, professionally cleaning, and if you have partial or full dentures, the dental professional will make sure that they will fit well and comfortable for you. It's time to wrap up. What are some things that you have learned today that you can do to have a healthy mouth? Thank you for your time today.